Hi, this is McKenna Abernathy for my psychology project, Abnormal Psychology, the treatment portion, and this is Christopher Bauman's Inventors in Psychologist's Office and Antipsychotics. So, in case you forgot from the first portion of the PowerPoint, Christopher Robin was diagnosed with schizophrenia. So he got some recommendations for treatment, such as medication and psychotherapy sessions. So a little bit about antipsychotic medications, which would be what he would be placed on. So antipsychotic medications are used to combat psychotic mental illnesses, is the best way to put that. And so it usually stabilizes things, lowers dopamine, a lot of things like that go on in the brain to help with schizophrenia. That's the main one that it usually treats, but a myriad of other disorders with symptoms such as hallucinations and delusions and disassociations, things like that. And so the 5 that have been A-okayed by the FDA for use under the age of 17, so 13 to 17, are risperidone, aripiprazole, olanzapine, duloxetine, and paliperidone. There's a lot of side effects, and they include things like dizziness and drowsiness and constipation and restlessness and headaches and weight gain, and it's a lot of things. But he also has some other options. So he has therapy options. And so there's a lot, but the 3 main ones that we're going to look at are social skills training. So social skills training improves communication, social interactions, and the ability to participate in everyday activities. So it's very base at it. It trains you for social situations. So for someone that is schizophrenic, who may have been unable in recent years to care for themselves, and interact with other people, social skills training will really help them build up the knowledge to be able to live a healthier life. There's also family psychotherapy, and the goal of this is giving the family unit more security, understanding, and build a stronger support system. And so this is very highly recommended for people with schizophrenia because it helps. Schizophrenia is such a misunderstood mental illness, that a family with one person in particular dealing with this may not understand how to treat them or how to deal with the person with this illness. And so this really helps the family unit as a whole. And then assertive community treatment. And this is sort of the most intense one. It uses a team of healthcare providers and frequent sessions to reduce hospitalization. So the healthcare providers could be anywhere from people like therapists, counselors, psychologists, psychiatrists, medical doctors, so like a pediatrician or just like a good old-fashioned general doctor, and pretty much anyone else who may be able to help out in this case. And frequent sessions usually means out once a week or so. And this is just a very intensive care, and it's to help keep an eye on someone, usually people that are having the worst problems. So faced with these options, Christopher Robin and his family had to do some thinking. They decided on a mixture of 2 things. They began to see a psychiatrist together as a group in family therapy, and the psychiatrist prescribed some antipsychotics for Christopher Robin. He said that the treatment should continue until either his symptoms cease or he proves that he is capable of living a healthy life without them. The psychiatrist explained to Christopher Robin and his family all about family therapy and what system therapy was. So here are some people that are founders and influencers of family therapy in specific. So Sigmund Freud developed psychotherapy. He was the first person to excuse me, come up with the whole sit on the couch and tell me your problems, tell me how you're feeling type of therapy. And that's usually what we consider today. It's what we think of today when we think of psychotherapy. And obviously family therapy is just an extension of that, so I thought it was important to include him. And then Alfred Adler, who is a major influencer in modern individual therapy. So it's just sort of took Freud a little bit further and into a more humanistic approach where it was less of a let me analyze you as Freud had been, and more of a please tell me your problems and let me make you feel comfortable. And this is a very important aspect for family therapy, number one, and number two, especially if you have a schizophrenic schizophrenics are much less likely to trust people. And then number three, because he's a younger child, he's more likely to be afraid or uncomfortable or nervous to go to a therapist's office. In this case, a psychiatrist's office. And then we have Gregory Bateson, and he developed the systems theory, which is a major pillar in family therapy, modern family therapy especially. And we're going to go over him a little bit more right now. So the systems theory, which is, like I said, a huge pillar in family therapy, was developed by Gregory Bateson. He was born in 1904, died in 1980, and he was an American anthropologist, researcher, theorist, and he did not develop the systems theory. It's a little bit more complicated than that. The systems theory basically means that it's a way of thinking that you should look at the whole of something instead of just individual parts. But he, in the 1940s, was the first to apply the systems theory to psychology. And so in family therapy, this systems theory has 7 main principles. So the first one is that the whole is equal to more than the sum of its parts. So the family as a whole is worth a lot more than just this person and this person and this person and this person. Number 2, systems are highly organized and relationships are consistent. That one's a little bit self-explanatory, but systems, in this case the family, thrives on being organized and having a path to follow, if that makes any sense. Number 3, systems are defined by boundaries. However, too intense boundaries or boundaries that are not enforced can make for a much weaker system. Number 4, the behaviors of individuals can't be understood without reference to the systems to which they belong. And I like this one because it lets me talk a little bit more about what exactly a system is. And so a system in this case can be a family. Like we're talking about family therapy, usually that's what we mean when we're talking about systems. But it could also mean a team you're on at work or school, your peer group, any sort of team is the best way to describe it that you're a part of, is a system. And you can't understand a person until you look at the systems that they're a part of. And so you can't necessarily understand Christopher Robin unless you also analyze and make reference to his family and everything in there. Number 5, circular casualty. Not going to talk very long on this one, but it's basically that if one person gets hurt, the casualty from that pain will transfer on to the next person, and so on. Number 6, homeostasis. Systems seek stability, but must be able to change in order to stay healthy. So they want to be very firm and rigid, but they still need to be flexible. And number 7, systems are goal-directed. It's very self-explanatory. And so, he even gave them a link to a video all about what they'll be doing. And I can't play it in